Welcome back to another podcast from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom. And this is DocJenFit.
And we are here to give you another episode on foot pain. So this time we're specifically going to talk into Morton's Neuroma. And if you're not sure what that is, stay tuned. We're going to give you tips and tools on how to relieve it.
All right, here we go in again on foot pain, specifically talking Morton's Neuroma.
Talking about pain on the bottom of the foot, kind of up toward the toes a little bit more, but still toward the ball of the foot, kind of between the second and third toes. So we want to explain what this is, how it might develop, and kind of what causes it, and then talk into ways that you can start to prevent it. I mean, preventing is key here. So even if you haven't experienced this yet, let's get into those feet so we can prevent it, but also how to reduce those symptoms.
And you have a little experience with Morton's Neuroma specifically, don't you?
I do. This was actually in grad school when I was in New York, and I was doing a little bit more running on a treadmill, and I was not wearing Vivo barefoot shoes yet. And it was cold, so I wasn't outside. I was running on a treadmill all the time. Not that I'm going to say that's horrible for you, but I know that I didn't progress my feet into the way I would have now.
Yeah. So anytime you hear neuroma, you think nerve or abnormal nerve something. Anytime we feel nerve pain, is that thing that can be kind of tingly, sharp, stabby. It can radiate up the heel to the calf, even into the leg. They say that more severe cases can be like you're stepping on a marble or a stone, or if it gets really bad, it's like stepping on a Lego.
Sometimes that severity of that radiation, that pain, if it's going on for so long, it can even start to kind of cause radiation up into the ankle, maybe up to the lower leg. But you're really at least looking at that pain right between those second and third toes at the bottom of the foot. Like Dom said, that collection of nerves right there. And they're being compressed and irritated for some reason. There's just that extra compression right into the nerves in that area.
So there's a lot of bones, a lot of nerves, muscles, tendons, everything. So lots of things that could be kind of impeding on or compressing into that nerve. Just try squeezing the side of your foot. So if you go, and squeeze the foot, does that make it a lot worse? Because when we squeeze it, we're kind of compressing on all the structures in there a little bit more. Or if we dorsiflex the foot, which is bringing the foot and the toes up towards the shin, that is also going to compress the structures of the foot a bit, and it might worsen with that.
That's how, for me, when I had it back in grad school, that's how I tested it. You're in grad school and you're like, ooh, I have this diagnosis. But really, I just kind of grabbed right around the ball of the foot. So you're not going toward the middle of the foot because it's toward the toes. I'm going around and I'm really compressing. You'll feel that elicit and light up and say, yep, that's the pain I'm getting when I'm walking or when I'm doing something. Some of the things that might elicit some of these symptoms or cause potential neuromas can be the types of shoes that we wear. So especially for women, which it's 5 times more likely. A lot of women's shoes, even if they're not heels, they're still pretty pointed. So imagine where your foot and your toes are coming together. You already have continued compression there.
And that was 2 of the main things that they talked about, was the narrow footwear, specifically in the narrow toe boxer towards the toes, and an elevated heel. Because if we're constantly wearing elevated heels, all of the structures on the bottom of the foot are kind of going to shorten. So then the dorsiflexion will be even tougher.
There could be other things that contribute to this. So whether you've had some foot trauma, whether it's from sports or an accident, there could be just thickening of the ligaments and the muscles in the area, causing some swelling, causing some extra compression right into those nerves, different kind of growth spurts, impact sports. So all of these things can cause certain neuromas.
If you're feeling this type of pain, if you squeeze the foot and it gets worse, there are things you can do. And that's going to kind of be what we go through. It's okay, so what? If I'm feeling this, what can I do to help?
Well, if it's compression of the foot, right, then we want a wider shoe. However, the thing that usually gets talked about with a wide shoe is that it's wider kind of in almost the middle of the foot or a little bit toward those toes, yes. But then we still get that compression of the toes where it still kind of narrows. So I think we need to lean away from the idea of wide shoes, and we actually need to go more toward the idea of a wide toe box.
We always encourage people to try out barefoot type shoes, walk around the house barefoot more often. And of course, if you're looking at getting barefoot shoes, we have a code for Vivo, TOB 15 special for our podcast listeners. We always encourage people to go try them out, get 15% off.
You don't really want insoles into a Vivo barefoot shoe, especially with barefoot type shoes. You're getting used to wearing virtually nothing on the feet. So you have to get used to progressing your foot into that over time, just like loading a barbell over time, right? We're not going to suddenly just squat a bunch of weight. We're going to progress over time. So it's the same thing with your foot.
Like if you have some grass that is softer grass, like you're not going to go and run over rocks right away, right? But over a couple of years, like when we were in Hawaii, I was hiking barefoot. I literally took my shoes off and we were on some rockier trails. And I'm like, whatever, I'm going to go for it because my feet have become so acclimated to feeling any little nuance or any little roughness underneath my feet, which I love because my structures are getting a lot more used to that. Other than, going barefoot, having a barefoot style shoe, we love to encourage people to find that initial space in the foot. So doing things like using toe spacers. And one of our favorite techniques is just take your socks off at the end of the day, weave those suckers between your toes and just sit there for 5-10 minutes and see how it feels. And you'll probably start to notice, ooh, this feels a little different.
It doesn't cost extra and it doesn't have to take much time. And it's a really passive way of stretching your toes without, go barefoot and go all this stuff. Like if you have Morton's Neuroma, you already have pain. So what can we do to help decrease that tension and compression? One of the best ways is getting some space between your toes, and it's going to take time. But if you do that consistently every day, like the moment you kick your shoes off, interlace those socks between your toes, it's going to start to help. And then start to practice spreading your toes, right? Get into the active habit of not just passively sitting there with the socks, but then trying to spread the toes, even if they don't spread, but you're trying to get that mind-body connection to start to activate.
And of course, anytime we're talking about an inflammatory disorder, we always just want to talk about what general lifestyle modifications can we make that are gonna put less inflammation into the body. Like, are we doing a lot of impact sports? Are we doing a lot of jumping? Is there a way that we can modify and find things that, might still reach the intensity level that we're looking for, but are we swimming? Are we doing things in a pool? Like that's a great way to offload the joints, but still feel like you can do explosive work.
Yeah, we have to have some activity modification during the time of having this intense pain in the bottom of your foot. So going along those anti-inflammatory techniques, obviously getting things within your diet that help to support your body to reduce some of that inflammation is huge for the nerves. We don't think that the nerves get inflamed, but they do. So, just getting a nutrient-dense diet, adding in water. Whole foods. One of the things that we did come up with and we love is our Genius Mobility product. And that's just like a little powder supplement that you can add to water on a daily basis. And to really, it's just filled with so much stuff to really help reduce that inflammation in the body.
My favorite is using it in smoothies. It's like a great little smoothie ad. And you can pack in some like kale. I love frozen cauliflower and things like that. And then put a little scoop of that in it. It still tastes like a fruity acai bowl. So great little ad there. But alongside with that, just drinking water. I think you mentioned getting good sleep, making sure we're doing those general anti-inflammatory techniques, and also some movement-based stuff or using different tools that might help you calm down what's going on in those feet.
Yeah, one of the balls that we talk about the most often, I would say, is the yoga tune-up therapy ball. So that's like kind of their smaller ball that's going to look like the size of lacrosse, but give you a completely different effect. Now, obviously, I do not recommend putting that ball right where you're having that pain, right? We have compression of the nerve already there. We wouldn't want to add compression already mixed in with that. However, you can put the ball toward the heel or toward the middle of the foot where you're not having pain and help to reduce some of those tissues that run along the same area of the foot to help reduce some of that tension and pressure. And then we love the IntelliRoll if you're going to use a foam roller because of the way that it's shaped for the body. Like it's truly shaped for the body.
Just cradles your body.
It really does.
Like a baby.
So it's so easy to not, because again, for foam rolling, you don't want to just roll back and forth really quickly. Same with the ball. You want to actually slowly, intentionally kind of roll your calves through that foam roller, find the tension areas, and you can kind of rock back and forth. Again, if you're on YouTube, we'll show you like the divots in the IntelliRoll that help to support so that you can kind of rock and feel every part of your calf area and kind of get into that release of tension, because releasing that calf and relaxing that calf area is going to help to relax the bottom of the foot area and take tension and compression off.
And then once we start to get maybe some of this relaxation, then going into things that, might not be what you do right when you're feeling your worst symptoms, like sitting in a big toe stretch. So just sitting on your heels with your toes curled under and getting some real good extension. That'll stretch all the way through the toes and through the bottom of the foot. Also, just then working into some foot exercises where you work on flattening and arching of the foot. You're working on that, what's called pronation and supination of the foot. And Jen shows a lot of exercises like that on her Instagram.
Anytime people ask me, what's happening in my foot, what I'm feeling, have you done what I post on Instagram? Have you tried even just one of those swipe throughs? Like, try them and make it consistent. You find something that feels hard or difficult, continue it on. It takes work. It takes that consistency. And then we can start, we still need to stretch the calves, stretch the ankle into dorsiflexion, start to become okay with putting your foot into that extreme range. Obviously, again, if you're having intense symptoms, that's going to take time. So only go to what your body can tolerate. You do not need to push into pain. You push into where you feel the tension in the area you're intending to stretch, which is your calf or your ankle, but you don't want to push into pain where you're feeling it in the bottom of your foot.
Yeah, and once we continue to get used to this, just working on heel raises. Maybe just standing on the ground and raising up onto your heels. And then you can start putting something under your toes, again, to start working those toes and that foot towards the shin a little more, being more comfortable with that, but then controlling in a little bit more of a strength type exercise where you're standing with your toes on a book that might just be an inch tall, and then starting to do raises there. And you can progress to where you have your toes on a step and you allow your heels to go down as far as you can and then go as high as you can onto your toes.
Yeah, so it's really about continuing to listen to your body, but continuing to give it some feedback. We can't just completely do activity modification and say, okay, I'm just going to stop running and everything's going to get better.
And then I'm going to go back to the same thing that caused it in the first place, or resulted in that pain in the first place. All right, there we go. Another PT Pearl on how to resolve some of that foot pain you may have been feeling. Comment below if you have any questions on anything that we talked about, or if you have topics that you want us to cover in the future on PT Pearls.